to me.
Yes, I was like, no, take it, in Jesus' name.
You rebuked it.
I rebuked. And then she was like, no, you go. So in the evening, I was there. I was trying to eat fish. I felt like throwing up. I was like, hey, how come? Maybe. So that thought started coming. And then this thing she said, she was like, I wish you could give birth to twins. I can't. But
I rebuke it.
Yes, I was like, I rebuke it in Jesus' name. But still, then in the morning I was like, no, I think let me go and do it and test. When I'm going there and they tell me, yes,
you went to the clinic?
I went to the clinic. They're like, congratulations, you're pregnant. I was like, no, it can't be.
Were you excited about it?
Not really, because I was not ready, you get. So I came back, I was like, okay, what do I do? Should I give birth? Should I do what? I was like, okay, let me give birth to this child.
Okay, you liked it.
So I was like, okay, let me move on with a baby. I didn't want, but I had to.
You had to accept the situation. Thank you so much, Zoe.
Yeah.
Today we're looking at antenatal care. Antenatal visits, antenatal care, when you're preparing your body to deliver the baby. There are certain guidelines that you need to follow as a mother. Yes, and that's what we are going to look at. When was your first visit during that time when you had just conceived?
I think I went there at 5 months.
5 months?
5 months. I took long.
Why did you take so long like that?
I really don't know, because I didn't know what to do.
Whom were you living with by then?
By then with a man, with my husband.
Were you living two of you in the house?
Yeah, we were living 2 of us in the house.
Where were your parents?
They were in the village.
Oh, they thought you at school, yet you were in the hostels?
Not really. Let's not go into that. But I was staying with a man by that time. Okay. And then later on, when we got to know I'm pregnant, I was like, okay, let's have this baby. Okay. So from there, I came back. 1, 2, 3, 4, 5 months.
5 months.
It was a little late. When I reached there, that was the time I think they were introducing scan by that time.
By that time,
yes.
Okay.
So when I went, they took my urine, everything, test, and they're like, why did you take long? I was like, I don't know, but as long as I'm here. So they took.
Were the nurses kind to you?
Yeah, they were kind.
Helpful?
They were helpful by that time. And I think I started it then after, when the baby was around 6 months, I was like, I think I need someone to help me with this. Because there are signs that could come and I could get scared. Like sometimes you feel something like something, I have no idea, you get. So I needed someone to help me through that.
Understand what you were going through. So
my mind was like, I think I should take you and stay with my mother that's in the village. And he took me to his village. And
Where was that village?
In the place called Apache.
Apache, okay.
Yes, So I went there, and it's where I was staying. I went to stay with the mother.
Is that where you went for the first antenatal, or you were still here in Kampala?
No, here I went to Chisubi Hospital. Okay. Then later on, I had to go back to Apache Hospital.
So when you went to Chisubi Hospital, did they discover any abnormalities, any need, any challenge with you, or everything was normal?
Though when they could ask for my age, I could fear. I never wanted them to know. So I could, I tell them I'm 22, 28. I was still in teen.
You were still a teen.
Yeah. Okay. It's like now 22 this, and I'm like, okay, fine, go. But I had that fear in me. I was like, will I really manage to push this baby? You get? I was like, for sure, will I really? So that was it.
What was your fear? What was your
my fear was like, will I push? You get? Because I grew up seeing people pushing, they push the baby. So I was like, will I make it? How will it? And whenever I could see some challenges, because there the baby kicks, and whenever the baby could kick, I was like, what is this now? You get? I didn't know, I had no any idea. Yes.
Let's talk about the process. When you went to the hospital, what exactly did they teach you? What did they do to you?
When I went to the hospital, the first thing, there are these tablets you're given as a mother.
Folic acid?
Yes. And they tell you must swallow it every day, before you sleep. Actually, in the morning and in the evening. And it helps a lot. I think it gives you enough blood.
It helps a lot.
It helps a lot. Yes. So if you're there and you don't visit antenatal, then please better do it, because those tablets that you're given I know it helps a lot.
Okay.
So I was given, but still I didn't want to. I didn't want to take them. I was like, because I didn't know. They first didn't explain to me. So I was like, maybe they give these people with HIV and AIDS. I was like, but me, I'm not. Why would I? You get it? So they didn't explain well, or maybe she did, but because I had this, you know, so I was like, no. Yes.
Oh dear. So what other tests did they carry out during the antenatal visits?
When I went, it was HIV and AIDS, urine, and then later on, they took me to a counseling room. Should I say so? Yes. And then later on, should I call a scan also?
In the counseling session, what did the counselor tell you before we go to the scan?
Okay, she was like, you know, you okay, everything is fine, and you will be able to push. The way we are seeing the baby is in a good position, so you'll be able. And she was like, and your height is also okay. So like, does the height matter? Yes, sure. Then she was like, you know, your height is okay. I think you'll be able to do it. So I became, I was like, oh, I think I will. You get it? So I was like, I think I'll be able to push the baby, and it kept me going. I was like, if she's saying everything is okay, so I think I will. Yet when I was at home here, you know, I was there alone, like I'm talking to no one is telling me what to do, so I didn't know what to do, and I was depressed. I was like, God, will I make it? But when I got a chance of seeing her and she encouraged me and whatever she was telling me, I was like, I think I will. And you know, I felt at peace. So did you push the baby eventually? I pushed the baby, but still, if I'd pushed the baby from home, I would have lost her.
Were you planning to give birth at home?
Not really, but because I didn't, let me say, a first pregnancy. This is your first time, you know nothing, you don't know how it pains, you don't know how it comes, you get. Because me, I started experiencing pain, I think, like a week before. And I was like, I think it's the time. And you go there telling, no, you know.
It's not your time.
Yes, it's not the time, go back. So I didn't, like, I knew nothing completely. Now, when time came, when I went there, and they're like, yes, this is now labor. To Shazita, the baby pained me from, the baby started at 2 a.m. in the morning until the following day. The following night again, 2 a.m. in the morning.
You were in the village?
Yeah, but
in the hospital?
Apache hospital.
Okay, you're in the, was it a government hospital?
Government hospital.
Okay. So, and during that time, was there someone giving you some psychosocial support?
Yes, yeah, I was there with my mother-in-law. Yeah, she was there with me, but still, you know, I could move around because they tell you to walk.
Of course, do some exercises.
Yes, go. So time came, I was like, God, why would this child pain me like this? And Father, I pray if she's a girl, let her even tomorrow experience this same pain again. You get, those are the things I was saying, but I didn't know.
You didn't know the implication. Of course, you were very young. Sorry about that.
Yeah, but
that was a very traumatizing experience, though. But thank God you got some counseling before that moment came. So how many times did you go for antenatals?
Let's say 5 times.
Five times.
Yes.
Were you given a card or something to keep on following up? Yeah, we're given a card,
and they write for you the date you should be reporting back.
Did you regret leaving school?
Of course I did, but later on I went back.
Okay, you went back to school after the first child.
Yeah, later on I went back to school.
Now, time for labor has come. What came into your mind at that time?
My God, by that time I was like, what? I was like, God, how am I going to really, you know, I didn't know what to do. And now the nurses came, they're like, you know, it's the time now, come. And they tell you now, begin, push. You get that time? I was like, push. They say, no, something else coming. They're like, no, don't worry. Whatever is coming, whatever comes out, we need everything. Just do what? Try your best. Just try your best.
You followed all that.
And I did. And for sure, before I think I reached there, if I'd given birth from home, you know, since I was in the village, if I thought I'd not taken to the hospital, I would have lost my child. Because I managed to push, yes, but by the time I pushed the baby was already tired. The baby couldn't breathe or cry. They had to bring a pumping, I don't know, they used something to pump the baby, then she picked up, then she started breathing, I started crying. That was after 40 minutes. And then the nurse was like, the midwife was like, the baby came out so very tired. You get? And I bleeded. a lot.
Sorry.
So if at all I was home,
it wouldn't be easy for you.
Yeah.
It's a journey to motherhood, and we are looking at antenatal care. In case you're watching us from wherever you are, this is Bethany TV. Our show, A Journey to Motherhood, airs every Saturday. We normally start from 9, and in this show we basically host mothers and a doctor to respond to all our needs. You can watch us on YouTube, Bethany TV, Uganda, on X, on Facebook, and you get all this information. And if you want to share with us anything, please feel free. The lines are going to be on. You can send us your WhatsApp message. You tell us what you went through as a first-time mother during antenatal care. What did you learn during antenatal care, and what are the regrets you have for failing to attend to antenatal cares when you were still expecting? I'm Teacher Zita, together with Teacher Zoe today. Nyapendi, she's telling us all the experiences she went through as a first-time mother and why antenatal care visits are very important at that early stage. Zoe, you were in the labor room and you gave birth, you bled. Yeah. After the bleeding, what happened?
After the bleeding.
Yes. Were you staged? You went back home with normal, or nothing happened?
No. Teacher Zita.
Tell us about that stitching time.
The stitching time. Don't talk about it.
I told you there was nothing like.
No, of course I was. I was given how many? They told me 2. I don't know.
Were you still feeling the pain when they're pinching?
Yes, they are. Because I expected maybe them to give me injections that I don't feel the pain. Nah. They
didn't give you?
They didn't.
It was manually?
Yes. And I felt it, and then I was like, I don't think I'll ever give birth again. And then anyway, I thank God for those nurses, midwife. They were so good, friendly. They were nice. After stitches, let me tell you, I think I took some days without sitting down, because they told me don't use a chair, but sit down.
And now you sit down flat?
Yes, I should sit down flat. And when I'm getting up and I couldn't visit the toilet, let me tell you, kalo is our food. But there's no way you can eat kalo because you won't visit the toilet. So,
please, wait. Yes. You are told not to visit the toilet?
Not really. We were not, no. You're free. They don't tell you anything about that.
They don't buy you from going?
They don't, yes.
You have to go.
You have to go.
But when you go there, there is another experience altogether that you face.
A lot.
What was that experience?
Oh my God.
We want to hear that. There's a mother watching you there. It's like, oh, I'm going through that. Yes, we want to air that and see how best we can help a mother out there.
It's like this, immediately after that first day, second day, third. Remember, you're told to sit down, and that pain you get, and you have to use, we were told to use salt, omo, hot water. And then later on,
using the salt and omo and hot water for washing the wound or bathing?
The wound. Yes, washing the wound. And that's also some serious pain. By the way, you go through a lot of pain.
Wasn't your mother-in-law helping you?
Of course, but you can't tell her to help you there in your private part. You have to do it yourself. Of course, you have that fear.
But literally, what I know, like in the culture, that especially in the north, mothers-in-laws are always there to give you a hand.
Okay, she's there, but to press your stomach to make sure it goes back.
Yes.
And then the bones, yes. But there's some parts that really
you can feel like
you can't.
You shouldn't.
Okay, she would wish to do it, but you yourself, you're shy and you're like, no.
Yeah, sure.
There I live, I will. You get,
understand.
Yeah.
That was not very easy. Okay, then the second child.
And the second child.
Yes, when did you go for antenatals?
The second child was as well. That one I started a little early, because now I now got to know what to do. I started early, and I also gave birth normal. So though still I went through the same. I still got the stitches. Still the same.
Thank you so much, Zoe. For a mother watching you out there, what message do you have for them as far as antenatal visits are very important? Because most of us think, so long as I'm normal, I work, I wake up, eat well, do this, do that, I can go for antenatal when I feel, anytime I feel. Do you have any message for someone to learn from your experience? Yeah,
it's not that you should go there when you feel or when you want. So very much important to visit antenatal when you're pregnant, because there are so many things they discover. these days. You might be carrying a child when the child is maybe abnormal, but when you visit there, that's when you get to know everything. And again, when you visit, there are so many lessons. They tell you so many things that you don't know, and it really helps a lot. So I request mothers out there, by the time you get to know you're pregnant, let me say 2 months, 3 months, please visit the antenatal care, and you'll be helped.
Thank you so much for this, for sharing us with that piece of advice. It's still a journey to motherhood. We're going to have a very short break, and when we return, the doctor will be here on set to give us more light on antenatal visits. Stay with us.
At lunchtime, we bring you back-to-back inspirational music videos. You request your favorite gospel music video, and we play it on the playlist. To request, go to our socials: Facebook, Bethany TV UG, and Twitter at Bethany TV. Like and follow, then type the name of the song in the comment section of the playlist post of the day by me. Showing on Bethany TV. In the ER, when there are more patients than resources.
He has to take the governor's wife.
That's not your call. It's a medical decision.
She needs to go to surgery.
Doctors, was either patient anticoagulated? No.
It is called Code Black.
Infiltrated the clot. Positive for blood return. Let's get her home.
I'm sorry.
Code Black, coming this November on Bethany TV every Thursday and Friday at 9 to 10 p.m. with repeats Mondays and Fridays 11 to midday. Showing on Bethany TV, growing and multiplying.
Father, we thank you that as we've joined our faith on this earth, whatever
touching those close and beyond, the Word of God ministered, lives changed.
Our God made a way for the children of Israel, and they made it to the promised land.
the day of salvation, and today is a day of freedom for you in Jesus' name. If you believe it, say amen.
We celebrate the resurrection because Jesus is alive.
It's a brand new day. Here we go, we say it's a brand new day.
Never miss the Watuto Sunday service every Sunday, 10 to 11:30 a.m. live on Bethany TV for health.
Health Minutes on Bethany TV. Self-medication is taking drugs, herbs, or home remedies on one's own initiative or on the advice of another person without consulting a doctor. Medicine is safe when the people who are using it have sufficient knowledge about its dosage, time of intake, and the side effects on overdose.
Medicines can be small poisons, remember? Whereas they can cure diseases, they can also be taken wrongly and they become poison. So disease from self-prescriptions, self-medications, or even sharing medicines. The symptoms for the body can look the same, but if you take medicines because so-and-so took them, they are feeling exactly the same way, the diseases may be different.
It is recommended to get a health checkup and to take medicine that has been prescribed by a healthcare professional according to the diagnosis made before taking any type of medicine.
Take that medicine according to the prescription from your trained, professional, licensed health worker.
Better healthcare for a better tomorrow. That was the Health Minute.
Bethany TV for health.
Welcome back from that break. It's still a journey to motherhood on Bethany TV. We had a very short break. We're now back with Dr. on the set, and he's going to tell us more that we need to know. In case you've just joined us, this is a journey to motherhood. In this show, we basically look at the process, what it takes during pregnancy. We empower mothers, we help mothers, we sensitize them, and we help them lead a better and positive process during that journey, because it's not easy carrying a child. Preparing your body is the first step. You carry the child, and then you give birth to the child, and then you nurse the child. All that long process needs a hand, and Bethany TV is here to give you all that through all the counseling session, through all the testimonies, and through the sharing of experiences from different mothers, and with experts' opinion from our doctors. Today on the set we have Dr. Wawide Emmanuel. Is an obstetrician gynecologist. He's here to tell us everything that we need to know about antenatal care. Good evening, doctor.
Oh, good evening.
How are you?
I'm fine.
Welcome to the show. Yeah. It's a mother's show, but you know, you are the doctor, and you are there to guide us, help us, whatever. Yes, say hello to the mothers who are watching you.
Hello, our dear viewers.
Yes.
Dr. Wawide Emmanuel is my name.
Yes.
An obstetrician and gynecologist at Bethany Women's Hospital, Luzida.
Thank you so much for the services you're doing. It's not easy to give birth, maintain it, and, you know, wind up with it. Doctor, today we're looking at antenatal care. We realize that most of us mothers tend not to know why we should go for antenatal care as early as possible. In most cases, our main interest is to only go there to see the picture of the baby, the growth, the sex of the baby, the weight, and something like that, not knowing that there is something very important at the beginning as a mother to look out for. That is actually antenatal visits and preparation of the body. So we want to look at this, doctor. When should a mother prepare themselves for antenatal visits?
Well, first of all, antenatal care, as we call it, is the care given to any expectant mother right from the time they conceive their babies. So this care should start the earliest the mother notices that they are pregnant.
Even 2 weeks' time?
Usually this is at the time when they miss their period. That's when they should start.
Okay.
Yeah. Actually, ideally, this care should have started earlier, pre-conceiving.
Before you conceive,
yes,
you should first prepare your body.
Yes.
Okay.
Yes, yes. So mothers that are expecting to conceive, are planning to conceive, are advised at least the bare minimum to start on folic acid. The time frame when they should start it is debatable, but ideally recommended at least 6 months before your planned conception, and then now you can continue. So
wait a minute, doctor, before you conclude that statement. So we should start taking folic acid before we conceive.
Ideally, we should all be planned children. We should all be planned kids. So a mother should conceive the idea of getting a baby, and then now you plan to conceive. Usually this would involve screening for certain diseases and infections, and also optimizing your body, preparing your body for a healthy pregnancy and an optimal outcome. That's a healthy baby and a healthy mother as well at the end of the journey.
Okay.
So ideally, the care should start pre-conception with all the screenings, and so to assess the risk. For example, if you have infections that we know that may affect the pregnancy, it would be better to get them treated before you conceive. For example, if you had syphilis, so it would be much more beneficial if it was treated before you conceive.
Before you conceive the baby.
Yes. So the timing should be, you've had a contact with the healthcare workers, you've had counseling, genetic counseling, preconception counseling, assessing your risk for that pregnancy and optimizing. That means bringing your risk to the bare minimum where possible. If there are any health conditions, they are addressed. Yes, and then so it's unfortunate that most times most pregnancies are by accident.
We have not planned for them.
Yeah,
they just come and say.
People are in enjoyment.
All of a sudden.
Enjoyment on enjoyment, and boom, say, oh, we are pregnant.
Okay, okay.
So they didn't know, they didn't plan for it, they didn't know. And so most babies are not planned, they're accidental, but they are wanted. So they decide to keep them.
Thank you so much, Dr. Emmanuel. Let's look at what is done during antenatal when we go there, because sometimes you realize you go for antenatals and you're only given medicine, you're not guide. Back in the days, our old midwives would help you, they educate you, they tell you do this, do. We don't know exactly what happens, because when you talk to many mothers, all they know is just go and do a scan. If the baby is fine, then you're done. What is exactly done during antenatal visits? There should be like four main aims of antenatal care. Okay. One, identify the risks. Identifying the risks. Yes. That you are carrying as a mother. Yes. Okay. The risk to the pregnancies and addressing them where possible. Okay. Two, risk like let's look at risk likes. So there are many things that could affect the course of pregnancy. Pre-existing maternal diseases, hypertension, kidney disease, high blood sugars, heart disease. So all that is detected during all antenatal. That is screened for during antenatal. So we are gauging your risk as a mother who is pregnant. So are you having a low-risk pregnancy? Are you having a high-risk pregnancy? Do you need more attention? Or you need the routine care that everyone else gets. Okay. So we screen for the risk factors. We monitor the growth of the journey of the pregnancy. Okay. So we are assessing, are we hitting the milestone as we should? Is the baby getting the weight they should? Is the mother still on course with a health pregnancy, or we are getting into trouble and need to address. Okay. Then education. Education, yes. Let's talk about the education part. So education, involves one, identifying the danger signs in pregnancy. It's a fragile journey. True. So things can occur anytime, anywhere. And sometimes the things that may occur along the journey are things that pose a threat to life. So educating the mother when to identify and which signs to identify. Should look out for. Yeah, that they should look out for that scream danger, and maybe they need to get to hospital. Thank you. Then also assessing addressing the common complaints that may arise. Heartburn, headache, discomfort, pelvic pain, sometimes infections, things like that. At one point, as a mother who told me, Chazita, I feel like putting away this baby. I'm now 8 months old. I can't sleep. I can't see it. I feel like there's a heavy stone down here. What should I do? So usually now the mother needs counseling. Really. Yeah, sure. And I think when we follow your steps, doctor, by the time you reach that journey, you can be able to calm down because you're ready. Yes. So many times, some of the complaints, some of the discomforts, just a mother needs reassurance and giving them hope. Thank you so much, Doctor. Thank you. Thanks a lot. I think you've got the clear information from Doctor. Education is here. It's one of the best points I've got. When you go for antenatal cares, find out what you as a mother you should do, what you should come out with. The right information from the doctors. Don't just go and then you take your folic acid. You should as well research. You should ask as many questions as you can, start to prepare your body and mind, because when that time comes, you'll already be in the know that, oh, doctor told me during this stage I'll feel this, during this stage you'll be, so it will be just a walkover for you when you visit antenatals very early. Doctor, yes, please. Can any health worker carry out antenatal care? Anyone, or there are special people supposed to do this job? Ideally antenatal care is a team. It's a service provided by a team. Oh, this team headed by an obstetrician, but helped by the midwives. Okay. Usually. What does the midwife do exactly? What do midwives do? So the midwife, one,
can do screening, is trained, the midwife is trained in identifying the risks. Education. Yes, a midwife is capable of addressing most of the complaints or disseminating the information that the mother needs during pregnancy. So a midwife can do, it depends on the level and the facility where the mother is seeking for this care. So you may find that here in town, urban areas, this care is mainly given by the obstetricians. Yes, but mothers that are seeking care from lower health centers and mainly public institutions, midwives are well equipped to give care, mostly to mothers with low risk. Yes, those who have no ongoing ailments, those who have, so can give the information, can monitor the growth of the baby, and the midwife knows when to refer these mothers to the obstetrician if they need if there is need to address any issue that has arisen. For example, a mother is getting high blood pressure, the mother is identified to have high blood glucose, or any other health condition that may arise during,
Thank you so much, doctors. What questions should mother ask majorly? Because at times you go there and you don't even know what to say. You're just waiting for your name to be called, and then you go and get that injection. Or what should exactly a mother look out for? And for example, the basics that they should really get before they move out of the hospital.
Well, I would advise every mother that from the time they have left, maybe from their visit, they should have a notebook and note every complaint or any question that arises.
Within your body.
It could be within your body, it could be a question it could be something about maybe what you should eat, which maybe medications to take, which supplements to take, which symptom means. Say I have headaches, say I have heartburn, I have pain in the pelvis, I have muscle cramps. So it's better you note them, because sometimes it's hard to remember all the things, the important things that you have. Then at your next visit, if you have your questions, you at least strive to have them answered, the things that arose. Usually usually when I meet these mothers, my first question is, what new thing has come up since our last visit?
Do they always give you back the feedback?
Of course, some have, others have not had anything new, and really that's usually what brings a smile on our faces when nothing bad has happened. Yes. But also if something has come up during that time between the last visit and the current visit, we are happy to help.
Thank you so much, doctor. Let's talk about folic acid, because most mothers, including me, we don't like folic acid. There's a way, it's not bad, it's not the scent is not bad, but there's a way all the time you have to swallow it, swallow. Before we look at the importance of folic acid, doctor, how much should a mother take? How much folic acid should a mother take?
So, the recommendation is between 400 to 500 micrograms of folic acid daily.
Wow. Okay.
So this is just a small tablet, usually one tablet of folic acid, usually during the pre-conception and the first 3 months of pregnancy, which we call the first trimester, that is sufficient. Usually after the first trimester, we usually take it in combination with iron.
Okay.
Yes.
Okay. Thank you, doctor. If a mother does not take folic acid regularly, or they don't take it at all, what are some of the risks that are likely to face?
I wouldn't recommend mothers to skip on folic acid, because the benefits, of taking prenatal supplements or nutrients, macronutrients, or multivitamins, the benefits are well documented. So, taking folic acid, for example, if a mother conceives with low reserves of folic acid in the body, and they don't adequately supplement this folic acid, it has shown that their babies at a very high risk of developing abnormalities we normally call neurotube defects. These are abnormalities of the spinal cord, of the central facial structures, like cleft lip, cleft palate, abnormal brain development,
all that
abnormal spinal cord development.
When the mother abscond from taking folic acid.
Yes. So modern mothers will ask you a question, did our mothers take this folic acid? Our mothers never even attended antenatal. But our mothers, our grandmothers had an array of supply of fruits and vegetables.
So they had habits were better.
So they got this from the foods they ate. And compared to us who eat more processed foods, most of them are not fortified. So usually it's recommended that a mother diligently takes the folic acid. Yeah, there is a product out there for at least every mother. If this one causes you nausea, if the other one causes you heartburn, if the other, at least you talk to your doctor, talk to your healthcare provider. They should find you a product that usually should work for you. Yes.
Thank you so much. It's still a journey to motherhood. This is Bethany TV. Our lines are on. You can give us a call or send in your messages on WhatsApp on the numbers running on the screen. And the doctor will be able to give you a feedback. We have a message from a mother on WhatsApp. I think she's inquiring. Mustafa, I could forward the message. We shall respond to the message immediately. She's saying, thank you for the show. My question is, does pre-eclampsia survivors stand a higher risk of heart diseases, brain and kidney damage in the future? This is a mother asking you, doctor.
Well, a mother who has healed from preeclampsia.
Doctor, can you kindly define for us preeclampsia so that someone understands it better?
Well, preeclampsia, in a simple language, this is high blood pressure with its first onset in after the first 5 months of pregnancy or 20 weeks of pregnancy. Its detection, if high blood pressure is detected in a pregnant mother who was previously normotensive after 5 months of pregnancy, it's called preeclampsia. Of course, it's associated with other abnormalities, but that is in simple terms, in a layman's language. High blood pressure of pregnancy is preeclampsia.
Thank you so much.
So a preeclampsia survivor stands a higher risk of developing high blood pressure in future. But we know that usually preeclampsia resolves. Yes, at least by the 6th week of after delivery.
Thank you. Thank you so much, doctor. Good evening, doctor. How many scans should pregnant mothers do throughout the pregnancy, and what is the schedule? This is James from Kasana.
So James, a pregnant mother could do as many scans as
possible,
as indicated in the pregnancy. But there are scans, at least that we know that we should do. One, the first contact.
First contact?
First antenatal visit.
So
we say this visit should be when the mother first notices that they are pregnant. So the goal of that scan is to confirm the pregnancy and also to confirm where the baby has implanted. Because we know babies could sometimes implant outside the uterus, giving rise to what we call an ectopic pregnancy, which is usually a danger to the life of the mother that needs immediate attention. So the first scan is one, to confirm the pregnancy, confirm that the pregnancy is well and thriving, so that we call it viability, and also confirming the site of the pregnancy, whether it is a normal pregnancy or it is an ectopic pregnancy. The next scan usually is indicated at around, now depending on when you do the first scan, sometimes we do this scan like at around 5 weeks when you are not certain whether the baby is viable or is alive. So usually that is indicated by the fetal heartbeat. Sometimes at 5 weeks we don't see it. So we recommend to do another scan to confirm viability, to confirm that the pregnancy is well and thriving. So we do another one, usually 2 weeks after the first one, to confirm viability. So more or less they do the same thing. Then we do a scan at around 11 to 14 weeks, 13 weeks. We start to screen for abnormalities. We call it a neutral translucence scan.
That is from week?
So week 11,
to week
13.
Okay.
Yes.
That is still in the first trimester?
We are still in the first trimester.
Okay.
So like at the border, the end of the first trimester. So we are starting to screen for abnormalities. So if that scan is normal, we do another scan at 20 weeks.
20 weeks?
Yes.
That is the third scan now?
Yes, usually 18 weeks to 22.
Okay.
Normally we do it at 20 weeks.
Okay.
That scan is an anatomy survey. We're also now taking a detailed study of the baby to see if there are any gross abnormalities that can be detected. Yes, if that scan is normal, we could do another scan at around 32 weeks. 28 to 32 weeks.
Okay, that is now the third trimester.
Yeah.
Okay.
So now here we are monitoring baby's growth. Yes, if you are on course, yes. And then from then, towards between 36 and delivery of the baby, which would be between 37 and 40 weeks for most mothers, sometimes up to 41 weeks, we could do several scans. Usually they are fetal surveillance scans. We are looking at how the baby is doing. We are planning for delivery. We see if we can wait on, we should deliver now or yet. But there are mothers who would present with complications earlier on and they need serial scans. So those ones are indicated as when the need arises.
Okay. Thank you so much, Dr. Bethany, thanks for the show. I'm Mommy Skylar, but I'm 10 weeks pregnancy. I'm 10 weeks, I think. I'm 10 weeks pregnant. I haven't attended antenatal, yet I have too much oranges and banana. I think she take too much oranges and bananas every day. Does those fruits contain folic acid? This is Mommy Skylar.
Yeah, Mommy Skylar, those fruits contain folic acid, albeit at very low levels.
Okay.
My advice to Mommy Skylar is to book her next antenatal visit.
Okay.
As soon as she can.
Thank you. Thank you so much, Doctor. There is a mother who sent me a message and said, "Good evening, Chazita. Thank you so much for the show. I went for the scan throughout my pregnancy, but on the last day of my scan, the last day of my antenatal visit when I was supposed to give birth, they found a cord round. Is it something like a cord round on the neck of the child? Why couldn't, what could have not prompted the doctors to see this earlier on?"
Well, a cord, an umbilical cord, is like a rope.
Okay.
Tying the baby between 2 points. The baby's stomach and the placenta, or the mother's uterus. And the baby is in a pool of water, changes position day by day, hour by hour. It is less likely to happen in the last month of pregnancy because the baby usually doesn't have room, but it can happen.
Okay.
The baby can turn at any time.
It can turn any time.
Yes. So I usually give an example of a goat tied to a post on the rope and it's moving up and down. So sometimes it entangles itself.
Oh yeah, sure. And that's
so
the
that's
same thing that babies do.
The same scenario that happens. So the other scans, truly there could have been no cord around the neck, and because of the baby's movements, the baby finds themselves
tangled up.
Yes.
Thank you. Joan, I think you've got your message clearly from the doctor. In case you want to speak direct to the doctor, please feel free. The numbers are running through the screen. You can call or you can WhatsApp, but calls are open, the lines are open. You can call and talk to Dr. Emmanuel and he gets back to you and gives you your feedback. We have another message here. Hello, thank you for the show. My question is, if last time I gave birth after 41 weeks, could it be possible to give birth after 38 weeks on this pregnancy? This is Jane.
It is very possible, because these pregnancies are different between women and between pregnancies in the same woman.
True.
One woman who has an induction in one pregnancy can have a spontaneous labor in the next pregnancy. One who had maybe delivering at 41 weeks may have their labor start at 37 weeks. So it's very possible.
Okay. Thank you so much, Doctor. Before we go to this other question, Doctor.
Yes, please.
Let's go back to the tangled cord.
Yes.
When you discover, or you as a doctor, when you discover that the cord has tangled up, how best can you help a mother during that time? Apart from C-section.
Mothers shouldn't worry so much about the cord around the neck, because a big number of babies will have a cord detected around the neck at the time of scanning, usually in the last trimester or any time in pregnancy. Usually what doesn't worry us is if that cord is loose, and usually the sonographers or the ultrasound specialists usually tell us whether the cord, one, how many times it's going around the neck, and how tight it is around the neck. So most babies actually have that cord around the neck, and we deliver them daily with the cord around the neck. If it's a loose cord, there's chance for a vaginal birth. We just continue to monitor the mother in labor. Yes.
Okay.
Only when the cord is tight or is more than once around the baby's neck that it would be dangerous for the baby to continue or to opt for a vaginal birth, because that cord could strangle the baby and
during the time of
delivery.
So in such a case, you need
losing the baby.
The baby or even the mother or both.
Yes. No. The cord around the neck may not put any risk on the mother's life. Really, it's the baby now here at stake.
Doctor, because sometimes when you're pushing the baby, you feel like you can't breathe anymore. So now here the baby is stuck.
Well, their discomforts are right from the time, usually starting from the late second trimester to the end of pregnancy, that a mother gets because of the expanding baby in the abdomen, the space. Because a uterus, usually when it's not carrying any baby, it's very small and barely felt. Actually, can't be felt when a doctor examines the abdomen. But now here we have a pregnant uterus carrying a baby almost up to the chest. So there is pressure, so there is that discomfort. Doesn't necessarily equate to being close to losing your life. Yes.
Thank you.
It's just a discomfort.
Thank you, Doctor. This is Sarah. I tested positive last week on Tuesday, but I had some pain on my left side. I think the left side of the uterine wall. But when I did a scan on Thursday, it's called a vaginal scan, to see everything came out well, but I still have the pain on my left lower back. What could be the cause of it? Yet they gave me paracetamol.
Well, usually in the first trimester, as the baby is settling in the uterus, there are usually those small adjustments that are taking place in the body. Many times mothers feel some discomfort.
True.
Yes, some discomfort in their pelvic area. The stella should be confident that those pains will go away.
Thank you.
If she, more so that she went to the hospital and they ruled out other causes of pain. Yes. So because could be infection, but if she had been to the hospital, I'm confident that the healthcare worker at least tried to isolate, to try to be sure that the other causes of the pain are not present, and maybe it's just
Thank you. Thank you so much, Sarah. Sarah, please take courage, just like Doctor said. That is why Doctor was saying it is very, very important for us to start antenatal care when we are still as early as 1, 2, 3 weeks pregnant. Because through this, during this, they educate you. There are certain things you are told and informed about, that when they come, it is something very normal. And those discomforts are always available because the body is trying to adapt to accept another foreign body into the body, and you feel a lot of changes within you. So thank you, Sarah, for your your concern. Another one is saying, hello doctor, thanks for the presentation. I'm Gift. I think we have a call online before we answer Gift. Bethany TV, good evening. Hello, good evening to you.
Good evening, madam.
How are you?
Good evening, madam.
Good evening to you. How are you?
I'm okay. You're talking to Ivan.
Ivan, where are you calling from? Oh, Ivan, we are losing you. You're calling from? Ivan, we're losing you.
I'm calling from Changira.
Yes, please. Go on. Doctor is listening to you.
My question is, can a mother exercise? At what stage can she does exercise someone like that?
When she's expecting?
Like at what stage can a pregnant woman go and exercise?
Thank you so much, Ivan, for your call. Dr. Emmanuel has got you. At what time, at what stage can a mother start exercises?
Well, exercises are healthy in pregnancy.
True.
Because of the physiological changes that take place in the woman's body during pregnancy, it is very hard to start exercises later in pregnancy. So the earlier the better. Preferably before you even get pregnant. If you've been exercising, you just continue.
Just continue and you feel normal and fit.
Yes.
Thank you so much.
But a mother can start exercise at any stage now.
Thank you. We have Hello, good evening to you.
Good evening, how are you?
I'm fine, thank you. How are you?
Yeah, I'm Justin from Bukoto.
Yes, Justin, go on.
I attended the antenatal up to the last day.
Okay.
But after delivering, even I went for scanning and it was showing the baby is okay.
Okay, Justin.
Then after 2 weeks, then my one leg got swollen after delivering.
Okay.
So when I went back to the hospital, and then they told me that that is where the baby grew up from. And then they gave me some medication, but still my leg refused to go back to the normal size.
Sorry about that, Justin. Dr.
How long ago did she deliver?
How long ago did you deliver? How old is the baby now?
My daughter is now 6 years.
6 years old?
Yeah.
Thank you so much, Justin. Doctor wanted to know. Right. He's getting back to you. Yes.
Well, it is strange that Justin can have her leg swollen for 6 years. Up to this time,
yes.
Yes. Usually, there are things that can cause swelling of the legs. Immediately after delivery, usually the body is adjusting to the changes that happen during pregnancy.
True.
When a mother gets pregnant, because of the demands of the growing baby, has to increase their blood volume, their cells, their water, things like that. And when they deliver, where all this blood has been pulled, usually it's pulled in the uterus and but the uterus has shrunk, so all this volume is sent back to the mother's general circulation.
Okay.
And you may find them usually swollen in the first days or weeks after delivery. So usually that is normal, physiological, resolves over time. It's a normal changes.
Thank you.
Sometimes may be a sign that high blood pressure has set in. Sometimes mothers can have a smooth journey throughout pregnancy and delivery, but then receive them back to the hospitals a few days or weeks after delivery with high blood pressure. And the first sign that maybe the pressure is high could be the swelling of the legs. If one leg is swelling, usually we are worried that there could be a clot
somewhere
in that leg. Yes, in the leg.
Okay.
Because we know pregnancy and the time immediate after pregnancy, we term it as a hypercoagulable state, that the blood easily clots. So it's a time when clots can easily form. So if one leg is swelling and it's painful, usually that could be the babies don't usually grow in the legs. So that explanation wouldn't really explain for them. But she should see maybe like an orthopedic surgeon, the bone specialist, and the experts in the diseases of the muscles and the bones to evaluate further why her leg is swollen up to 6 years.
Thank you, Doctor. We're running short of time, yet we still have some messages here to read. We promise you, as usual, that next Saturday we shall start from these messages that we have not read out because of time. We are almost signing out. Doctor, please give us your last word to mothers who are still asking you questions. They're inquiring about you. There have so many questions, but next Saturday, God willing, if we still host you, we shall start from here. To mothers there who are absconding from folic acid, especially, that's where my focus is. Yes, what should they know? What should they really carry on and know and learn from this show, that from today onwards, I need to go and start with my acid?
So, first and foremost, I should encourage all mothers expecting, one, attend antenatal care.
Thank you.
And adhere to their scheduled visits.
True, thank you.
And take, at bare minimum, the prenatal supplements that are given. They do a lot to prevent lots of complications during pregnancy, both to the mother and the baby.
Thank you.
Yes.
Thank you so much, Doctor. That has been A Journey to Motherhood, Bethany TV, from me and the team. Thanks so much for watching and being with us. We see you next Saturday during this show again. Sleep well. Thank you.